My name is Lakia Turner, and I am the director of the Delaware Medicare Assistance Bureau. If anyone has any questions after today's seminar, please do not hesitate to contact our office at 302-674-7364. Everyone likely received information in regards to our program. We are the State Health Insurance Assistance Program, and we are funded in part by the Administration for Community Living. We provide information and assistance for all Delawareans who are on Medicare. We have trained volunteers who are throughout the community that can provide you with one-on-one assistance. So if you need, after this presentation, if you have any questions, you want to meet one-on-one with someone, please do not hesitate to reach out to our office. If anyone is interested in becoming a volunteer, you are well versed, you have navigated through the Medicare program, you want to assist those in the community, we do provide training for anyone who is interested in becoming a volunteer. So if that is the case, please contact our office. We also offer presentations in the community. So if you're having some type of health fair, community event, and you are interested in a speaker, our office can present at that function for you. So we are going to learn about Medicare on today. And the first question is, what is Medicare? Medicare is health insurance for people who are age 65 or for someone who is under 65 and has disabilities. Medicare is for anyone who has end-stage renal disease, which is permanent kidney failure requiring dialysis or a kidney transplant. Anyone who is eligible for Medicare must be a U.S. citizen or lawfully present here in the United States for at least 5 continuous years. A lot of times people ask, what agencies are responsible for Medicare? Most individuals do enroll with the Social Security Administration. For those of you who work for the Railroad Retirement Board, you would actually go through the Railroad Retirement in order to sign up for Medicare. For anyone who is a federal government employee, the Office of Personnel Management actually handles federal retiree premiums. And Medicare is administered through the Centers for Medicare and Medicaid Services, which is also known as CMS. So that is the agency that you will receive your explanation of benefits from. If you have any questions and you are on original Medicare, the Centers for Medicare and Medicaid Services will be able to assist you. So you ask yourself, when is the appropriate time for you to sign up for Medicare? Everyone has their initial enrollment period. That lasts 3 months before your 65th birthday, the month of your 65th birthday, and 3 months after. So there is a 7-month window in which you can sign up for Medicare. Medicare always starts on the first day of the month. So you cannot start it in the middle of the month. Also, if your birthday falls on the first day of the month, your Medicare actually starts the month before. So if your Medicare starts on April 1, it actually started on March 1st. So again, there's a 7-month window in which you can enroll in Medicare. For those of you who will continue to work, there's probably a lot of you, we found that many people continue to work past age 65. If you will continue to work past the age of 65, you will be eligible for a special enrollment period. That enrollment period lasts for 8 months, and it starts when you are no longer receiving, it starts once your coverage ends through your employer. So if you will continue to work, you can definitely sign up 8 months after. You will have a form that is completed by your employer. That is a form CMS L564, which shows that you had health insurance coverage while you were employed. Your other option, the other form that needs to be completed is the CMS Form 40B. So there's two forms that will need to be completed when you stop working, okay? So for those of you who decide that you do not need the coverage, let's say you use some type of holistic services, or you say, I can't afford it. The problem with that is if you do not sign up when you are first eligible, the next time that you can sign up is during annually between January 1 and March 31st, and that is every year. So every year between January 1 and March 31st, those who do not sign up for whatever reason, they will have to wait until that general enrollment period, which runs every year between January 1 and March 31st. There is a yearly Medicare open enrollment, which runs October 15th through December 7th. That's a 7-week period in which you can change your Medicare Part C and D only. So that is your Medicare Advantage if you choose to enroll in a Medicare Advantage plan, or if you decide that you want to sign up for a prescription drug plan. So that is the one time a year that you can sign up or a Medicare Advantage plan or a prescription drug plan. There is also the annual Medicare Advantage open enrollment period. That period runs every year between January 1 and March 31st. So if you decide that you are enrolled in a Medicare Advantage plan, you do not like that Medicare Advantage plan, then you can make changes during that time. Or if you can go back into another Medicare Advantage plan, or you can go back into original Medicare and choose a prescription drug plan. Your coverage will start the first day of the following month in which you enroll. So if you enroll during the month of February, your coverage will actually start March 1. If you enroll in March 1, your coverage will begin April 1. So there are special enrollment periods for Medicare Advantage plans and Medicare Part D. If you move out of the planned service area, so you're a Delaware resident, and let's say in a couple years you decide that you want to move to Florida. Unfortunately, these Medicare Advantage plans and Part D plans are sold in the state that you live in. So if you move outside of Delaware, you will need to find a new plan. If you have Medicaid and you no longer qualify for subsidy, then you can choose you can choose a new plan. If you have a Medicaid and every month you find out that maybe a plan isn't working for you, in most cases that doesn't happen, but you do have the opportunity to change prescription drug plans every month in 2025. If you're in a plan and the plan leaves Medicare, reduces their services. If you leave or lose an employer union plan, you can get coverage. If you want a 5-star plan, unfortunately, Delaware does not have any 5-star plans, so that does not apply here in our state. Or if you are sent a retroactive notice of Medicare enrollment, you would then be allowed to have a special enrollment period. So, there are people who qualify for one of those special enrollment periods. Anybody who is impacted by an emergency or a disaster, anyone who was formerly incarcerated, anyone that gets inaccurate or misleading information from a health plan or an employer, anyone who loses Medicaid coverage, or anyone who experiences some type of exceptional condition. Medicare may allow you a special enrollment period. If you are entitled to a special enrollment period, you'll have a 2-month special enrollment time to join a Medicare Advantage plan or a Medicare prescription drug plan. And that coverage will start the first day of the following month in which you put that request in. So, how are individuals enrolled in Medicare? For most people, it's an automatic enrollment if you are receiving Social Security benefits, okay? Even if you're under 65, you're receiving Social Security benefits for 24 months. On the 25th month, your Medicare will begin. You will get a packet that says Get Ready for Medicare. It will also include your red, white, and blue Medicare card. And generally, that comes 3 months before your 65th birthday. If your birthday is, if you find out that prior to about 1 month prior to your birthday and you are receiving Social Security benefits, you have not received your red, white, and blue Medicare card, then you are going to contact Social Security. Remember, Social Security is the agency in which most people enroll in the Medicare program. So when you contact our office, if you have not signed up for Medicare, you have not received your red, white, and blue Medicare card, likely we are going to refer you back to Social Security, because in order for us to provide you with assistance, we will need you to have your red, white, and blue Medicare card so that we can answer a lot of your questions. Medicare will send you out what is called a Medicare and You book. We encourage you to hold on to this book. This book is going to be a huge resource. It will answer a lot of questions that you have in regards to Medicare. So we encourage you to read through that book so that you know what your benefits are. It's all about self-education. Unfortunately, a lot of times you can say, I didn't know, but you are going to have to provide some type of proof to the federal government if you're looking for any benefits to start in which you missed those deadlines. So it's very important that you make sure you know what your rights are as a Medicare beneficiary. Some people will actually have to sign up. If you are not receiving Social Security benefits, you will have to enroll. You do not have to be receiving Social Security benefits in order to enroll in Medicare. Medicare is eligible to most individuals at the age of 65, regardless of if you are receiving Social Security benefits or not. So most people will need to sign up for Medicare when they turn age 65. So this screen shows you what your red, white, and blue Medicare card looks like. It will have your self-identifying Medicare number. It will have your entitlement dates for Medicare Part A and Part B. If you choose to enroll in Medicare Part A only, which is the hospital benefit, when you receive your card, it will say Hospital Part A only. You will then need to sign up for Medicare Part B when you stop working. If you accept that card, you will sign the back of the card, and then you will just go about your day-to-day your day-to-day life. Make sure you protect that card. It does again have a self-identifying number is on there. So once you provide that information to your provider, likely you will not have to show that at any other time. That card generally, the number does not change. So you will have that card. If you need a replacement card, unfortunately, our office cannot provide you with a replacement card. In order to get a replacement card, you will need to contact Social Security. Another option that you can use is I encourage everyone to create a mymedicare.gov account when you receive your red, white, and blue Medicare card. This will allow you to see the claims as it relates to your Medicare. It will allow you to tell you what preventative services you are eligible for. You will be able to view the different health and prescription plans that are available. And in addition, you will be able to order a new Medicare card. Sometimes when you call our office, and we'll talk about that, we do tell everyone Do not give out your Medicare information. However, I'm going to tell you, if you call our office and you want us to help you find a drug plan or a prescription plan, my staff will ask you to show will ask you for the numbers off of your red, white, and blue Medicare card. We are a state agency. We do not use this information for our own personal use. This information is confidential, and at no other time will we ask you for this information generally, but every year individuals come back to our office and we help them find health and drug plans. So we will ask you to share that information, but we do, when you are speaking with agents and you are speaking with those in the public, you do not share this information because we don't want you to become a victim of identity theft. So please keep that information close to you. So there are 4 parts to Medicare. There's Medicare Part A, which is hospital insurance. There is Medicare Part B, which is medical insurance. There is Medicare Part C, which is Medicare Advantage. And there is Medicare Part D, which is drug coverage. And we are going to talk about a little bit about all of them a little bit in detail. So again, there's a couple ways that you can get your healthcare needs. One route is going to be Original Medicare. Under Original Medicare, you will get Medicare Part A, which is your hospitalization. You will get Medicare Part B, which is your doctor services. You will add a prescription drug plan, and you will add supplemental policy in most cases. And we'll talk a little bit about what supplemental coverage is. The other option is Medicare Advantage, which is also known as Medicare Part C. This includes your Part A, Part B, and Part D. So you're going to get hospital coverage, medical coverage, and prescription coverage all in one. You also get some added benefits such as dental, vision, hearing, which traditional Medicare does not cover, but you will have to enroll in these plans. If you are thinking about a Medicare Advantage plan just because you want dental or vision coverage, you might find that it's even more affordable just for you to purchase a private dental or vision plan instead of enrolling in a Medicare Advantage plan. But again, you would need to make that decision. So we're going to talk a little bit about Medicare Part A and B, which is Original Medicare. So under Medicare Part A, you are going to get your hospital coverage, which includes a semi-private room, meals, general nursing, and drugs. If you are transferred to a skilled nursing facility, let's say for rehabilitation because you were in the hospital, then they will cover inpatient stay in a skilled nursing facility. But I do want to advise you that whatever you are being treated for in the hospital is what you are being transferred to that skilled nursing facility for. So let's say you have a stroke and they say that you need to go into the skilled nursing facility for rehabilitation. That is fine. Whatever you are going into the hospital, whatever you were admitted into the hospital for, that is what you are going to the skilled nursing facility. And you must have 3 days of inpatient care. So that means that when you are discharged from the hospital, going into that skilled nursing facility, that your discharge paperwork says inpatient. Please make sure that you educate your family members. If you are in a hospital and you are there for more than 3 days, generally you think that you are in there as inpatient. But sometimes we have seen that individuals have been there under observation. If you aren't in there under observation, they will not cover that 3 days of inpatient skilled nursing facility. So you want to make sure that when you are reviewing that information, that it shows that you were considered inpatient and not observation, because if it's observation, that skilled nursing facility will not be covered. Part A also covers blood, the first 3 pints. It covers hospice benefit for anyone who is terminally ill, and it also covers home health care services. For most people, your Part A premium is free. If you have at least 10 years of work experience and you have paid FICA taxes, then you have a $0 penalty. If you did not have at least 10 years of work experience, then you may have to pay for that Part A premium. We used to see a lot of times we had homemakers who did not have enough quarters. If you do not have enough quarters and you are married, it is possible that you may be able to receive your Medicare benefits under your spouse. So if you do not have at least 10 years of work experience, but you are married, you may be eligible to receive benefits under your spouse. If you do not enroll in Medicare when you are first eligible, there is a 10% penalty. Now, that penalty only applies when you do not have coverage through active employment. If you have coverage through active employment, then you may be fine. But this is generally when someone does not have active employment and you do not sign up, there is a 10% penalty. So under Medicare Part A, the hospital benefit starts on the day that you are admitted into the hospital or a skilled nursing facility, and it ends when you have received no more than 60 days of care in that hospital facility. So if you are, let's say that you're admitted into the hospital on March 15th and you're discharged on March 20th. And you go back into the hospital on April 15th. Because it's been less than 60 days, you are still in that same benefit period, okay? But let's say when you go into the hospital on April 15th and you're discharged on April 30th and you don't go back into the hospital again until 63 days, then that benefit period is going to start all over again. So you get a new benefit period every time that you are out of the hospital for more than 60 days. All right. So there's no limit to the number of benefit periods that you can have in a year. If you've been out of the hospital for 60 days, then that benefit period is going to trigger again, and you're going to have to pay that deductible. And we'll talk about what those amounts are that you will have to pay for that coverage in this next slide. So if you are admitted into the hospital before Medicare will pay anything, your deductible in 2025 is $1,676. That's for the deductible that you have to pay. Day 1 through 60, there is a $0 copay. However, day 61 through 90 is $419 per day. And if you are in the hospital beyond 90 days, from day 91 through 150 is $838 per day. After 150 days, you would be responsible for those costs. And generally, there's some type of arrangement that is made with the hospital. You guys are probably thinking, how am I going to pay for this? Generally, individuals purchase insurance such as a supplemental to cover this. Some people choose to go with a Medicare Advantage plan, and generally Medicare Advantage plan costs are lower than what these out-of-pocket costs are. So you have to make the decision as to what type of insurance is going to work best for you. The same benefits The benefits are the same if you have a mental health inpatient hospital stay. Medicare does cover mental health. In most cases, they cover under Part B 80%, and then you're responsible for the remaining 20% that Medicare does not cover. Also under Part A, there is a skilled nursing benefit. Let's say, remember we talked about you going into a skilled nursing facility after a hospital stay. The first 20 days, there is a $0 copay. However, day 21 through 100 will cost you $209.50 per day. Remember, most people purchase some type of insurance to cover that daily copay. If you're in a skilled nursing facility beyond 100 days, you generally apply for Medicaid or use some type of other insurance, which might be long-term care. If not, you become a private pay. So it's important that if you're in a skilled nursing facility beyond 100 days, that you work with a social worker to determine how you are going to make payment after that 100 days. Medicare Part A also covers home health services. While there is $0 for the home health services, there is a charge for durable medical equipment, which includes your hospital beds, your wheelchairs, your walkers. Medicare pays 80%, and then you or your insurance would pay the remaining 20%. Medicare also covers hospice care. That's for anyone who is terminally ill. It's $0 for the hospice coverage. However, there is a copay of $5 for prescription drugs to help with pain relief and symptoms control while you are in the home. Again, it also includes respite care. Let's say your family loved one is caring for you and they need some time, they have a planned vacation or they need some rest. They could put you into a facility for up to, I believe it's 5 days that they could put you in there, and you would need to pay 5% for the Medicare approved amount for that respite care. Again, the first 3 pints of blood, Medicare covers when you're in a hospital setting. If you are a member of the blood bank, you would provide them with your blood bank number, and they would send that information to the blood bank. So a lot of people ask, do you need to sign up for Medicare? For most people, it's free. It's up to you if you want to sign up. If anyone on here is a state of Delaware retiree, the state of Delaware does require you to sign up for Medicare Part A only if you are actively employed. So you will need to sign up for Medicare Part A. But if anyone is actively employed, talk to your health benefits administrator to make that decision. Anyone who is contributing to a health savings account, not a flex spending account, but a health savings account, you have to stop contributions 6 months prior to your Medicare enrollment. So I would encourage you to talk with your tax helper or the Internal Revenue Service so that you can ask them questions. Your tax preparer is the word I was looking for. I apologize. Your tax preparer or the IRS to help you determine how you work around the health savings accounts. So we've talked about Medicare Part A. Now we are going to talk about Medicare Part B. And under Medicare Part B, again, that's your medical insurance. You get your doctor services, your outpatient medical surgical supplies, your lab tests, your wheelchairs, your walkers, your diabetic testing supplies. They only cover the lancets and the test strips and the monitor. If you are insulin dependent and you use needles and syringes, that is covered under Medicare Part D, as in drugs. But the test strips, the monitor, and the lancets are all covered under Medicare Part B. Medicare Part B also covers preventative services, which we'll talk about a little bit on the next slide. They cover home health services, again, outpatient medical services, and prescription drugs under certain conditions. Medicare Part B covers preventative services. We want to point out a couple preventative services. Everyone is entitled to a Welcome to Medicare preventive visit. You get to have that Welcome to Medicare visit within the first 12 months that you are enrolled in Medicare. Pretty much your doctor is going to go over your end of life, your weight. There's specific questions that they ask you. It's not a routine exam, just so that you're aware, but it's a dialogue between you and the doctor. After that, you're entitled to a yearly wellness exam. Again, there are certain questions and things that they ask you during that yearly wellness visit. So those are two things that we want to point out. Medicare Part B does cover flu shots, COVID shots. They cover, ladies, your mammograms, gentlemen, your PSA, cardiovascular. So there's a list. And again, if you go into the Medicare.gov, you'll be able to see the different preventative services and what you can take advantage of. Some services that are not covered by Medicare A or B are your eye exams, your long-term care insurance. You can purchase long-term care insurance If anyone is interested in that, we can provide you with information on long-term care. There's routine physical exams that is not covered by Medicare, hearing aids, concierge care. We do have some individuals who sign up with concierge doctors. They charge an annual, we've seen $1,800 that they charge just for you to be a patient with them. Unfortunately, Medicare does not cover concierge services. They do not pay on those claims, so it's very important that if you're electing to sign up with a concierge doctor, that you know exactly what you are doing. Generally, they opt out of billing your services to Medicare, so make sure you do your research if you are considering a concierge doctor. And again, Medicare doesn't cover dental services. So in 2025, most individuals pay $185 for Medicare on a monthly basis. That amount is deducted from your Social Security check if you are receiving Social Security. If you are not receiving Social Security benefits, you can set up for Medicare Easy Pay. That's where they automatically deduct it out of a bank account. But if you're wanting to set up for Medicare Easy Pay, you will have to contact Medicare directly in order to sign up for that. Now, Medicare does charge your premium based on your adjusted gross income. And I'm going to go to the next slide, which shows those amounts. So if you are single, making over $106,000, or you are married, making over $212,000 a year, you can expect to pay more. And in 2025, they are using your adjusted gross income from 2023. So they use the previous 2 years. So it's important that you review this information. You do have the right to appeal these amounts if you have lost income, or maybe you receive some type of inheritance. There is a form that you can complete with the Social Security Administration so that you can lower those amounts. But you'll have to contact Social Security directly and tell them that you are interested in the IRMA appeal, and that's the income-related monthly adjusted amount. You'll understand that the federal government loves a lot of acronyms. So in addition to your monthly Medicare premium, there is a deductible that you are responsible for paying. So the first time that you use your Medicare, likely you will find yourself paying that $257 deductible. It's an annual deductible, and the deductible is the amount that you have to pay before the insurance will pay on a claim. So these amounts that I'm talking about, they change every year. So just make sure that when you're doing your research, you understand that these amounts will change from year to year. The way that Medicare was designed, it wasn't intended to pay at 100%. So Medicare pays 80%, and then you are responsible for the remaining 20%, or you purchase insurance to cover the remaining 20%. There is a $0 copay for most preventative services. However, you can't see a provider for those preventative services. While you do not pay for the preventive service, there is a copay in most situations to see the doctor to have that preventive service rendered. And again, it's an 80-20 cost share. But there are programs that are out there to help you. So we'll talk about those a little bit further in the presentation also. But if you're sitting here thinking about, how am I going to make payment for all this? There are programs that we'll discuss. All right. So should you keep Medicare Part A and B? Remember, most people will pay a monthly premium. It's $185. You pay that $185 premium regardless of if you go with original Medicare or you go with a Medicare Advantage plan. You have to pay the $185 for most people. And remember, for those of you who have a higher income, you are going to be responsible for paying more for those for that premium. and it's based on your income. Anyone who is actively employed. The rule is you have to be actively employed, receiving health benefits through the employer. That means every day you get up, you go to work, you're considered active under that. If you continue to work past age 65, you may be able to delay your Medicare. Okay. Most employers, if there are more than 20 employees covered under that group health plan, then they will allow you to continue with those group benefits. And in most situations, that group benefit pays for your services. And some people do sign up for Medicare, but in most cases, everyone, because a lot of times you'll be overinsured if you take the Medicare. So in most situations, we see that individuals continue with their group plan. And remember, as long as you're actively employed, receiving health benefits, you get that special enrollment period when you can sign up to 8 months after you retire. And there is no penalty. So you don't even have to worry about that penalty. But make sure that you check with your health benefits administrator at the employer to know whether or not you do need to enroll in Medicare Part A and B. And we're going to talk about, sometimes you do have to have Medicare Part B, and we're going to talk about when you do have to sign up for Medicare Part B. So, if someone is wanting to purchase a Medicare supplement policy or a Medigap policy, you will be required to sign up for Medicare Part B, or you want to join a Medicare Advantage plan. If anyone in here is retired military, thank you for your service, and you are eligible for TRICARE or CHAMPS VA, then you are required to sign up for Medicare Part B. And Medicare Part A. And if you're actively employed and there are less than 20 employees, you will be required to sign up for Medicare A and B. So I think that takes care of Medicare Part A and B. And like I said, the way that Medicare is designed, there's two ways that you go. You either go with original Medicare and purchase a supplemental, or you go with a Medicare Advantage plan. So now we're going to get into talking about supplemental policies and Medicare Advantage plans. So Medicare supplement insurance, you'll also hear me talk calling them Medigap insurance. And what these Medicare supplement plans do is they help you pay for out-of-pocket costs if you're enrolled in original Medicare. Okay, you only get a supplemental policy with a original Medicare. You cannot have a Medicare supplement policy and a Medicare Advantage plan. It's one or the other. These Medigap policies are sold by private insurance companies, and they are designed to use anywhere here in the United States. You cannot use this outside of the country. So if you are doing any travel outside of the U.S., it is recommended that you purchase travel insurance so that you have coverage. If you decide, this is something else that we see often, if you decide that you want to move out of the country and you won't need your Medicare benefits, and then for some reason your plan was to stay out of the country for the rest of your life, and you decide later on to come back in, the next time that you would be able to sign up is during the general enrollment period, and you might have a 10% penalty because you did not sign up. If you are moving out of the country, we would still encourage you to enroll in Medicare Part A and B, because you never know what might happen. More and more we see Medicare beneficiaries who move out of the country, think they're going to live abroad, and then something catastrophic happens, or whatever reason they decide that they want to return back to the United States and they don't have coverage. So if you're deciding to live abroad, also we encourage that you get at least Medicare A and B so that you have coverage if you have to come back, and you can eliminate that penalty. But back to the Medicare supplements, and I apologize for going off a little bit, but I wanted to make sure that we made you aware. Under these Medicare supplement policies, they are standardized plans. So you can't pick and choose out of a certain letter what you are interested in. No matter what plan you buy, they're all going to offer you the same benefits. they're sold by different insurance companies. The only thing that's going to be different is the price. When you're shopping around, we tell you don't go with the cheapest, don't go with the most expensive, go with something in the middle. There's going to be 3 ways that these companies can rate their policies. There's going to be the issue age. That's going to be based on the age you purchase the policy. It doesn't go up because you get older. It goes up due to inflation. There are going to be policies that are sold based on attained age policies. These policies increase every year. So you can know if you sign up for an attained age policy that that price is going to go up every year. There's finally community rated policies. That means everyone pays the same price regardless of their age. There's only one company here in Delaware that offers the community rated policy, just so that you know, so you're not going to be looking around. But again, all the companies offer the same benefit. They're just going to be charging you a different amount for those plans. So these are what the plans look like. They're plans A through N, not to confuse this with Medicare Part A and B. These are again called Medicare Supplement or Medigap plans. Plans C and F are no longer sold. So for most people because this presentation is intended for people who are new to Medicare, Plan C and F are no longer sold. Plan G is the most comprehensive plan, the Cadillac plan that covers everything. That is how these plans operate. I do want to point out plans K and L. If you look at this chart, you can see that most plans cover the benefits at 100%. If you're looking at plans K and L, Plan K only covers at 50% and Plan L only covers at 75%. So the premiums, they do have a higher out-of-pocket limit because of that. So you can see what those amounts are. I also want to point out Plan N, which is a little bit different. Plan N, with those plans, generally with these Medigap plans, Medicare pays 80%. And in most cases, the Medigap plan covers at 20%. However, for Plan N, you have copays when you go to the doctor. If you go to a doctor, you pay up to $20 for a copay, and it does have a $50 emergency room visit. We see a lot of people who don't go to the doctor sign up for Plan N. The only problem with these Medigap plans is when you sign up for this plan, it's intended that you're going to have this particular plan for the rest of your life. There's no annual open enrollment period for this, okay? So a lot of people call and say, I want to compare plans from year to year. You can compare plans every day of your life. And so what happens is you have a 6-month period. And I think I've jumped ahead. Let me go to the next slide. Oops, let me go back. Sorry. So with this, you have a 6-month period in which you can purchase a Medigap policy regardless of any pre-existing condition. So you have 6 months from the start date of your Medicare Part B to purchase a Medigap policy. And during this time, insurance companies cannot deny you coverage. They have to sell you a policy. Okay, and that is the only time that they have to sell you a policy unless you meet some type of special enrollment period. And generally a special enrollment period is because an insurance company has leaves the area. You can get a special enrollment period if you are in a employer plan and you and that plan terminates. Normally we see people who have a maximum limit on their employer plans that will be eligible for a plan. If you're moving from one state to another, that allows a special enrollment period. So there are certain special enrollment periods. I do want to let you know that the insurance commissioner does put out a book called the Medicare Supplement Insurance Shopper's Guide. Everyone received the link for this for this presentation, and included in that were several resources. And in that resource is the Medicare Supplement Shopper's Guide. So you're able to see these different plans. And you can actually call our office after you've reviewed this information. If you know what letter you're interested in, we can actually provide you with pricing, the rates for those plans. We'll give you all the companies that are licensed here in Delaware. We'll give you the pricing. We are not allowed to choose the insurance company for you or choose the letter. Unfortunately, that is something that you have to do, because we've had people who called us who will say, why didn't you tell us? You told us to enroll in this plan. This would be a scenario if we told you what plan to enroll in. You told me to enroll in this plan, but this plan didn't have skilled nursing facility. And now I'm responsible for the cost. So that's why we don't make decisions. I encourage you to talk with your family members, to talk with your friends. We can help you narrow down to what letter might work best for you, but we will not tell you what letter to choose, unfortunately. And again, we can provide you with the rates for these companies. So please reach out to our office so that we can help you with navigating this. We know that it's complex, it's confusing, it's a lot of information, but we want you to know that we are here for you in the event that you need help with choosing a supplemental policy. So a lot of times you ask yourself, do you need a Medigap policy? Remember, it only works with Original Medicare. So if you sign up for Original Medicare, then yes, a Medigap policy might be great for you. If you have an employer plan, if you're a state of Delaware retiree, will have health insurance benefits, you do not need a Medigap policy. Medigap policies are for individuals who will not have any health insurance coverage other than the 80% that is covered by Medicare. Another question, ask yourself, can you afford the deductibles and copayments? While you're healthy now, you may find that later on in life, you have some type of catastrophic illness and it's very expensive and you need help paying for these services. So we encourage you that if you can't afford this, then you consider purchasing health insurance coverage, or if you want to make sure that you do have coverage, that you sign up. Now, what is the monthly Medigap premium cost? It varies. We've seen it start at, let's say for a high deductible plan, maybe $100. But we've also seen for people who are new to Medicare where it starts at about $150. So again, it depends on the plan that you choose. And remember, attained age plans go up every year. So keep in mind that these plans aren't going to, it's not a fixed rate, that these plans can increase from year to year. So you want to make sure that you're going to be able to afford this insurance, because keep in mind that in addition to this insurance, you're also going to need a prescription drug plan, because there's no prescription drug coverage under this Medigap policy. When is the best time to purchase this? Again, it's the best time to purchase a policy is going to be 6 months from the start of your Medicare Part B enrollment date. During this time, companies can't refuse to sell you policies. They can't make you wait for coverage. They can't charge you more because of past or present health problems. So you want to make sure that if you're considering a Medigap, I want to point this out that if you decide, you're on the fence, you don't know if you want a Medicare Advantage, you don't know if you want a Medicare supplement. If you purchase a Medigap policy when you first turn age 65, and let's say 6 months into it or 2 years into it, you're like, you know what? I haven't been really using this policy. I want to see what a Medicare Advantage plan is like. They give you the opportunity to try a Medicare Advantage plan after you have enrolled in a Medigap policy. And you can try it out for 1 year. And if in that year you say, you know what, Medicare Advantage plan isn't for me, then you can go back into that Medigap policy. But that's not the same if you go from, if you try a Medicare Advantage plan and then you say, you know what, I don't like this, I want to try a Medigap. If it's after that 6 month period, you're going to have to go through medical underwriting. So it's important that if you've had any past, present medical conditions, that you know that this is going to be the best time that you can purchase it, and companies can't turn you down. So I encourage you to, really think about what's going to work best for you. Again, talk with someone here in our office. So how to buy a Medigap policy? You first have to determine what letter you want. Again, there's plans A through N. If you call our office, we go through each one to figure out what um, benefits you are interested in. And from there, we try to help you say, oh, you know what? Plan G works best for you, or maybe plan D works best for you. So we try to help you navigate that. After you figured out what letter you're interested in, again, you can call our office. We can provide you with the different insurance companies that sell in our state and also the rates. Now, keep in mind, we will not call the insurance companies for you. So that is something that you will have to do. We are not insurance agents. We don't sell insurance agents. That's why we too don't tell you which plan works best what plan to choose. So that's a decision that you would have to make. Shop around. Again, don't go with the highest, don't go with the lowest. Choose something that is comfortable for you. Once you choose that company that you're interested in, go ahead and submit an application. You do get a 30-day look period with that Medigap policy. So during that time, you can review the information, and if it's not something that you're interested in, then you would be able to terminate that policy. So just make sure that you have an understanding, and again, speak with a counselor here at our office. So we're now going to talk about Medicare prescription drug, because that's Medicare Part D, which I stated that is not included under the original Medicare and choosing a supplemental policy. So this would be in addition to the Medicare supplement insurance that you purchase. The Medicare Part D has been around for quite some time now. It was signed under President Bush back in 2008, I believe was the year. And it made prescription drug coverage available to all individuals who have Medicare. Medicare Part D are run by private health insurance plans. It either comes as a standalone prescription plan, or if you choose to go with a Medicare Advantage plan, Medicare Part prescription drugs is included in most plans. There are a few that do not include prescription drugs, and generally the individuals that go with that are individuals who are veterans because they use the VA for their prescription drugs. But if you are a veteran, you can also have a Medicare Part D drug plan too. How Part D works, it is optional, but we encourage everybody, even if you are not taking prescription drugs, that you choose and join a plan. The cheapest plan here in Delaware in 2025 is $0. And that is because of a program through the federal government that they are able to offer that prescription plan at $0. It is a legitimate plan. So if you don't take prescription drugs, we encourage you to enroll in that plan so that you have coverage. Because if you do not sign up for a prescription drug plan and you need it later in life, there is a penalty, and that penalty is for a lifetime. So I had a gentleman who was 80 years old. And unfortunately, he never enrolled in a drug plan, and he caught shingles. And the medication was $500, and he did not have a drug plan. And he called our office to sign up for a drug plan. And remember, you're eligible for a drug plan at 65, and he was 80 years old. Okay, so that was a 15-year penalty that he would have had to pay. So we encourage you that even if you do not take prescription drugs, make sure that you enroll in a drug plan. These plans are going to have formularies. that include a wide range of prescription drugs in each category. If something happens, you enroll in a plan, and let's say it's working for you right now. And later in the year, you find out, you know what, the doctor has prescribed me some medications that aren't covered. You do have an annual period in which you will be able to review your drug plans. And we'll talk about those open enrollment periods, which we discussed a little bit. But there will be a time that you can make changes. They will notify you in September of every year if there are any changes. Maybe your drug plan is terminating their contract with Medicare, or maybe the price is going up. Even if you're happy with your drug plan, and this is this route that you choose to go with, even if you're happy, please make sure that you review the documents that are coming in the mail, because these plans, while the plan is $0 this year, next year it might be $15. So we want to make sure that you're reviewing it every year so that you can make changes. It's important to know that when reviewing this information, that you use the preferred pharmacies, because that's where you're going to get the best price for your medications. In the system, it will show in-network providers, but the preferred providers are where you are going to pay the lowest cost for your medications. Generics are always the tier 1 medications. Tier 2 are going to be the preferred medications, and then you go into the tier 3, which are the non-preferred, and tier 4, which are going to be your specialty medications. So we can help you explore the different prescription drug plans also. And there is help to pay for these costs. So if you find that you can't afford them, please let us know. And generally, when we speak to everyone in our office, we screen them. We at least let you know, hey, there is prescription help that is available to help with those costs. And we, again, screen during our calls with our consumers. So with the Medicare Part D plans in 2025, you're going to pay a monthly premium anywhere from $0 up to, I believe, the most expensive plan is in the $90 plan. Even if you're happy, let's say there's a company and you're happy with that company, or you want to enroll because you know this company and you know the longevity. Please just make sure that you're reviewing, just like the just like the supplemental plans. There's plans that are $0 up to $90. A lot of times, again, you get to make an annual change. So make sure that you're actually putting in your medications into the system. We encourage everyone to create, again, a mymedicare.gov, because also creating this mymedicare.gov account, if you add your prescription drugs, it saves the information in there. So every year, instead of you having to add all of your prescription drugs, the information will be there. So you can just add medications or remove medications. So you'll be able to see when you're navigating the Medicare.gov, to be able to see what the monthly premiums are, the deductibles. I believe the deductibles this year is $545. There is co-payment amounts that you will be responsible for those medications. The system will tell you what you can expect to pay for those medications. I'm not sure how many of you know about the donut hole. It used to be a few years ago that when you reached the donut hole that you had to pay 25% for the cost of your medication. That donut hole has been eliminated under the Inflation Reduction Act. So now individuals, there is an out-of-pocket max on all prescription drugs in 2025. The amount is $2,000. So that means if your medications are $10,000, the max that you're going to pay is $2,000 for the year. They also began offering a Medicare prescription payment plan this year. Now, that allows you to enroll in a payment plan under the prescription plan. You have to do that directly through the insurance company that you choose. It doesn't lower your prescription drug costs, it just makes them manageable. So instead of paying a $600 drug costs when you go to the pharmacy the first month. Maybe they'll make you pay $166, and you'll be able to see in Medicare.gov what that chart looks like, what your payment plan will look like, so that you can make that decision. And a lot of times, again, that helps individual manage their prescription drugs so that they can spread the amount through across the year instead of paying it all at one time. So if you're interested in the prescription payment plan, you would need to contact the prescription plan that you choose for Medicare Part D. Just like Medicare Part B, if you have a higher income, you are going to pay more for your prescription drug plan in 2025. And if you look at the chart, you can see the additional amount. So you will pay whatever the plan premium is for your Medicare Part D. And if your income is over $106,000 as a single person, or $212,000 over for a married couple, then you will pay a additional amount for your prescription drugs. And that chart shows you what those amounts are. There is a Part D late enrollment penalty. Remember, I said that it's optional for you to enroll, but later on, if you decide that you want to enroll, and we see this more times than less, that somebody waits to enroll and then they have a penalty. Now, again, if you have some type of credible coverage, your state of Delaware retiree, you have TRICARE for life, you have veteran benefits, you're retired from a company and they offer you credible coverage, then you can you do not have to join a Medicare Part D. Now, if for any reason that you were ever to lose that credible coverage, there is a special enrollment period that you would be entitled to. But every year when they send those notices out in September, they will tell you if your coverage is credible or not. So you want to hold on to that so that you know if it is credible. For anyone who qualifies for extra help, you will not be assessed that Part D penalty. If you qualify for extra help, they would pay that penalty for you. But again, you will pay that penalty for as long as you live. That penalty is 1% for every month that you did not have coverage that you could have had coverage. So it's 1% for every month. Okay, so in 2 years, that would be a 24% penalty that you would pay. And that penalty is based off of the national base premium. In 2025, that penalty, that national base premium is $36.78. So for that person who didn't have it for 2 years, they would take $36.78 and multiply it by 24%, because they did not have coverage for 2 years, which equals 24 months. So that's what they can expect to pay. And that base premium amount is going to change every year. So that means that their penalty amount will change every year. So who can join a Medicare Part D plan? You must have Medicare Part A and or Part D in order to join a drug plan. Okay, so you do not have to have Medicare Part D. However, if you are enrolled in a Medicare Advantage plan and joining the prescription portion of it, you will need to have Medicare Part A and B. Also, if you join a PACE plan, you will need to have Medicare Part A and B or Part B only. And again, you must be a U.S. citizen or lawfully present in the United States in order to get a Part D plan. So when can you join a Part D? Remember, we talked about that 7-month window. 3 months before your 65th birthday, the month of your 65th birthday, or 3 months after. Remember, again, just like with Medicare Part B, it doesn't start in the middle of the month. It's always going to start the first day of the month after you enroll. Every year between October 15th and December 7th, you can make changes. Okay, we are in our Wilmington office and our Dover office during open enrollment, so that you can come in and sit with a staff member so that you can review your drug plan every year. So if you have a Medicare Part D plan only, if you have a retirement plan, you don't come into the office for those visits. It's more so for people who have a Medicare Part D plan only. If you enroll during the general enrollment period, that's between January and March of every year. Again, it starts the first day of the month after you submit your application for Medicare Part B. Every year between January 1 and March 31st, if you are switching from, you're in a Medicare Advantage plan and you want to go back into a original Medicare, you will be eligible to join a drug plan. Or if you're going from one Medicare Advantage plan to another Medicare Advantage plan, you will be able to. If you're new to Medicare, and again, you're enrolling in the initial enrollment period, you get that 3 months period. And also people who qualify for a special enrollment period. Anyone who has extra help, anyone who has a maybe qualifies for Delaware prescription, which we'll talk about that. Those are situations in which you can change your Medicare Part D outside of the initial enrollment period. Okay, the question is, should I join a Medicare Part D plan? If you have credible coverage, again, they send you out a letter every year in September letting you know whether or not your coverage is credible. You can continue to continue with that credible coverage through the employer. If you ever lose that coverage, then again, you would have a special enrollment period. They allow you 2 months to, if you ever lose coverage, 2 months to join a plan. So that you will take advantage of that 2-month period. You want to compare your out-of-pocket costs to know which Medicare drug plan is going to be best for you. Remember, all these plans have formularies. A formulary is a list of the medications that they cover. When you choose these different plans, you're going to add your prescription plans into the Medicare.gov system. If the system doesn't take your medication, likely that means that that is not a covered Medicare drug. If there is a medication in there that is expensive, you'll want to talk to your doctor to see if maybe you can take one of the less expensive medications. If you can't take the medications that are listed there and they're not covered, you would have to ask for an exceptions to the plan so that you would be able to take that medication. So it's very important that you review all that information prior to enrolling. If you don't have credible coverage, again, there are lifetime penalties. That's not something that we want you to have. So again, we encourage everybody, if you don't take medications or you don't want to use it, enroll in the plans, enroll in the $0 plan just so that you have coverage. And again, do you qualify for extra help? In a few minutes, I'll talk about extra help so that you can determine whether or not you qualify, so that you can join a plan and there's no penalty. All right, so if you decide that you want our office to help you or you want to do it on your own, we encourage everyone to go to Medicare.gov. There is a link that says Find Health and Drug Plans. You're going to click on that link. You're going to create a Medicare.gov account if you do not already have a Medicare.gov account. Once you're inside that account, you are going to add all of your prescription drug medications. In addition to that, you are going to add the pharmacies. It will tell you if the pharmacies are in network. If there is not an in-network pharmacy, we encourage you to choose a preferred. And again, that's where you're going to get your most cost-effective plans. If you decide, you know what, it's only a few extra dollars, then you can choose to go with those in-network pharmacies, because sometimes people pay a little bit more just for the convenience. 1-800-Medicare can help you. Our office can also help you. Again, we're local. Because Medicare does not have any local offices, we are trained by Medicare to be able to provide this service to you. Again, our volunteers are trained. Our staff is trained. So if you have any questions, you can definitely reach out to us. And what happens is when you decide to enroll inside that Medicare.gov account, we can also hit the enrollment button. As long as you enroll by the last day of the month, your coverage will start for the following month. So if you enroll March 31st, then your coverage will begin April 1. And the plan actually makes the determination whether or not to accept your application. So that is Medicare Part D, which is a drug coverage. And the final part of Medicare that we will talk about is the Medicare Advantage plan. So a lot of you probably see the commercials on television for Medicare Advantage plans, the infomercials that they provide. So we're going to educate you a little bit so that you can make an informed decision. So these Medicare Advantage plans are also known as Medicare Part C. Again, they give you your hospital coverage, they give you your medical coverage, they give you prescription drug coverage, and they may give you additional benefits, gym memberships, dental, vision, hearing. It's another way to get your coverage. These plans are offered by private insurance companies. So if you elect to enroll in a Medicare Advantage plan, you will no longer use your red, white, and blue Medicare card. You will actually use the cards that are provided by the insurance company. We have Aetna, Cigna, Highmark, Humana, and United Healthcare. So we have 5 different Medicare Advantage plans that are offered here in the state of Delaware. I do want to let you know that if you use Bay Health, hospital systems, or Christiana Healthcare systems, they do not contract with Humana. So that insurance will not work at those hospitals. So please keep that in mind as you are shopping around for Medicare Advantage plans. So that means you have to use their network of doctors, their network of hospitals. So if you decide that you want to go with these Medicare Advantage plans, we encourage you to talk with your doctors before you even consider it. Find out if they accept Medicare Advantage plans, what Medicare Advantage plans they do contract with, because you want to make sure that you are using their contracted providers. If you enroll in Medicare, you still have the same rights and protections as under original Medicare. You still enroll in your Medicare Part A and B. Remember, I said you still have to pay that $185 premium. And the reason why you're paying that is because the federal government is providing these companies with a subsidy to offer you these benefits. If you enroll in a Medicare Advantage plan, you cannot use your original Medicare for the services that are conducted under that Medicare Advantage plan, and they can't charge you more. Again, it includes dental, vision, hearing, are some of the benefits, and they do have yearly out-of-pocket costs with these Medicare Advantage plans. And again, this Medicare Advantage plan information, if you're shopping around, this information is in Medicare.gov so that you can review that information. It's also in the back of the Medicare and You book that Medicare sends out. These Medicare plans do have a service area, so you must live in that service area. So that's why you can only purchase plans here in the state of Delaware. These plans do have fixed amounts that you pay for the services. So keep in mind with these health insurance plans, likely you will pay copays when you go to the doctor, anywhere from $0 to $25 for primary care, anywhere from $35 to $55 for the PPO. So it's very important that you're looking at this information when you're shopping around. Hospice benefit is covered, but it would be under original Medicare. These Medicare Advantage plans are going to have different rules than original Medicare. So you want to make sure that you know the rules and regulations as it applies to those plans. So here in Delaware, we have 3 different types of Medicare Advantage plans that are offered. We have the health maintenance organizations, which are HMO plans. With these plans, you have to use their doctors, their hospitals. You will need referrals in order to go outside the network. We have preferred provider organization plans, which are the PPOs. With the PPOs, they have a network of doctors. If you stay inside the network, it's going to cost you less. If you go outside the network, it will cost you more. So as long as you stay inside the network, it's going to be more cost effective. We also have special needs plans for anyone who is on Medicare and Medicaid, or for someone who has a type of some type of chronic disabling condition. This year is diabetes is one of those conditions that falls under the special needs plans. So those are the different plans that are offered here in Delaware. So when can you join a Medicare Advantage plan? Again, you get that 7-month window, 3 months before your 65th birthday, the month of your 65th birthday, and 3 months after. Every year, you get the general enrollment period, which runs January 1 through March 31st. The month that you sign up, your coverage will start the first day of the following month. If you have a Medicare Advantage plan, you can make changes during the open enrollment period every year, October 15th through December 7th. And if they give you a special enrollment period. Keep in mind with these Medicare Advantage plans, they are on a yearly contract. So they may be here in 2025 and they may terminate it for 2026. So you may find yourself choosing a new plan every year. But again, they will send you a letter early September, October, letting you know that they will not be serving the area in the upcoming year so that you can make changes during that time. Again, we use Medicare.gov pretty much for everything. You go inside there, put in the medications that you take, put in the pharmacy that you use. Generally, if you choose on the particular plan, you can see their providers. I always tell individuals to check with the providers and also check with the insurance companies, because you want to make sure that they're both stating that they are contracted with the Medicare Advantage plan, so that you do not run into any issues. We also put out, the Insurance Commissioner's Office puts out a Medicare Advantage toolkit. So if you're interested in purchasing that, you can see the different types of questions that you should be asking, so that you know how those plans operate, because a lot of people don't realize when they enroll that there are copays or that you have to use certain doctors, and then they contact us and say, you know what, my doctor's not taking this insurance. So we want to make sure that you do your research and that you know what the rules and costs are before you sign up. So you ask yourself, should you join a Medicare Advantage plan? Are you interested in additional benefits such as dental, vision, hearing? Maybe you don't go to the doctor a lot, but keep in mind that's what a lot of people say when they enroll in these plans. And while you may not go to the doctor a lot, you never know what might happen. 10 years from now, something could happen to you and you find yourself going to the doctor more. Those $50 a month add up if you're going to the doctor twice a month. Again, are your doctors in the network? Every year the networks change. Here this year, going next year. So it's important that you're reviewing that information. Will you need a referral? Some people don't like having to go get a referral, and again, so that you don't have to get a referral, you can enroll with a PPO, which is the preferred provider organization. Again, if you sign up for this plan, let's say you sign up for it in the first couple months and you're like, you know what, I don't want this plan anymore. Unfortunately, there's only certain times that you can terminate. So if you don't meet a special enrollment period and you've signed up for one of these Medicare Advantage plans, you've committed to a full year. So that's something else to think about. And finally, it doesn't work with Medigap policies. Remember, you can't have a Medicare Advantage plan and a Medigap policy. It's one or the other. So there are some other health plans that are available. They're called the Program of All-Inclusive Care for the Elderly. In order to enroll in these PACE plans, an individual has to be 55 or older, because remember, Medicare is also for people who are under 65. So you do have to be 55 or older. You do have to live in the plan's service area. You would need nursing home level of care. Pretty much this allows individuals to live safely in their community instead of going into a skilled nursing facility. So that's how these plans work. We have two PACE plans here in Delaware. In Kent and Sussex County is PACE Your Life. That is, our office is in Milford. And then in Newcastle County, there is the Life at St. Francis Healthcare. And you would actually have to contact those facilities, companies, if you're interested in enrolling in either of those programs. Finally, we are going to talk about prescription drug assistance that is available. There are programs for people with limited income and resources. There's 3 different programs that we'll talk about on this evening: Medicare Savings Program, Extra Help, and the Delaware Prescription Assistance Program. So in 2025, there is the Medicare Savings Program. Under this program, there are 3. The qualified Medicare beneficiary, which the income limit for a single person is $1,325, and for a married couple is $1,783. The good thing about Delaware is we do not have an asset test, so that means you could have $1 million in the bank, but as long as your income is below these amounts, you would qualify. Under the Qualified Medicare Beneficiary Program, QMB, that would pay your Medicare Part A and B premiums, deductibles, the 20% that Medicare does not cover. Okay, so that's a very good program. There is also the Specified Low Income Medicare Beneficiary Program, which we call Slim B, and there is the Qualifying Individual 1 program. And with both of these programs, they only pay your Medicare Part B premium. So for a single person, your income cannot be more than $1,781. And for a married couple, your income cannot be more than $2,400. There is also Extra Help, which is available to individuals who have low income, and this helps pay for your Medicare prescription drug plan, which is also called Medicare Part D. Some people also call Extra Help the Low Income Subsidy Program. If you call over to Social Security and they refer you to our office, they're going to say, call over there about Extra Help. If you qualify for Extra Help, you pay no premiums, no deductibles, and small co-payments for your prescription drug plans. There is no $2,000 cap for the prescription drug plans with the Part D, and there's no Part D late enrollment penalty. So to qualify for this program, you have to have a monthly income as a single person less than $1,956, and a couple is $2,643. Now, unlike the Medicare Savings Program, the federal government does look at assets. And in 2025, the asset limit for a single person is $17,600 and $35,130 for resource limits for a married couple. Now, with this program, resource limits are your stocks, bonds, IRAs, mutual funds. Income would be your Social Security, any pensions, any net rental, any other income that you receive on a monthly basis. So that is the amount that those are the limits for those programs. Again, we screen you when we're speaking with these programs, or if you think you qualify, or you might even know a friend or a neighbor who qualifies. Please do not hesitate to refer someone to our office so that they can apply for these services. To qualify, some people automatically qualify. If you get full Medicaid, you receive Supplemental Security Income Benefits, SSI, or if you qualify for any of the Medicare savings programs, you automatically qualify for Extra Help. The Extra Help application is an online application through Social Security. If you call our office, we just ask that you have your Social Security information, your income, your resources, and we can help you. The application takes about 10-15 minutes, as long as you have all the information available that we need. The online application takes about 2 to 4 weeks to receive a response. The final program is the Delaware Prescription Assistance Program. It's a $3,000 benefit that is offered through the state of Delaware with the Delaware Prescription Assistance Program. They pay 100% of your Medicare Part D premium. They pay 75% of the deductible, and you pay $5 or 25% for the cost of your medications. DPAP does not participate with mail order drugs, so you have to be purchasing them at a local pharmacy. In order to qualify, you must be a Delaware resident, age 65 or older, or on Medicare due to a disability. And Delaware Prescription looks at you as an individual. So you could be a married couple. Each individual has to be making less than $2,608 per month. And in order to qualify, you must be enrolled in a Medicare prescription drug plan. And before you can qualify, you must be, in order to qualify, you must complete an application for extra help. You have to be denied extra helps benefits or approved in order for Delaware prescription assistance to cover you. But that is the first step of that process. So again, that extra help application takes about 2 to 4 weeks, and then Delaware prescription takes about 30 to 45 days to process that application. So generally it's a 1 month to 2 month process in order to qualify for that program. But that program does benefit a lot of individuals. I believe there's about 5,000 individuals here in the state of Delaware who do receive help from the Delaware Prescription Assistance Program. And it's from a tobacco settlement years ago, probably 20 years ago, that they started offering this service. So it's a very good program. So some key reminders. Medicare is a health insurance program. You do have to enroll in most cases in order. It's not automatic. Remember, it's not going to cover everything at 100%. It's only 80%. It was never intended to cover at 100%. You do have the right to get to make the choices based on your individual needs. Please speak with a counselor here in our office. Our hours of operation are Monday through Friday, 8 to 4:30. So someone is available to help you. Decisions are going to affect the type of coverage that you get. So make sure that you know what you are enrolling in. Some of them are time sensitive. There's a lot of deadlines. We don't ever want to see anyone be assessed any penalties because of late enrollment. There are programs to help you with choosing this coverage. So please do not hesitate to reach out to our office. Again, our information is on most of the resources that are available, but if for any reason you do not have our contact information, it's 302-674-7364, and a counselor will help you navigate this. Again, thank you for attending, and have a great day.